Yes, we're currently reviewing the impact that our legislation, the incentives and other aspects of legislation have had on innovation. The need to balance and ensure that we have both innovation and access. And if we look at the picture which is emerging, we have to realize that Europe is losing its share of this important area. More and more clinical trials, for example, are happening elsewhere. We have to understand the reasons for that. And I think, we have to find a balance to ensure that while we promote innovation every possible way, we do so also by ensuring access. This is a fundamental requisite. So the European Commission is currently looking very much at this aspect. It should be, I think, a key area for work in the next 5 years. We're reflecting on the best way to do that, and for that we're of course looking at all the evidence we have. Indeed, you cannot separate one from the other. To have access, you need constantly to develop new treatments, better treatments. There are still a lot of unmet needs, which we still have the need to respond to. On the other hand, innovation that does not ensure access is rather meaningless. And so the two are two sides of the same coin. It's not a choice between one or the other. And any strategy that we have or could put in place in the future must have as a foremost objective to ensure both simultaneously. Disruption in the sense that we are going to see, and we're already seeing, radical changes in the model of how healthcare is delivered. More patient-centered, patients having access themselves to more information, the need for more effective dialogues between patients and healthcare providers. What does this mean for the training and continuous professional development of health professionals? The networking among institutions, among professionals themselves, in an age of increasing specialization and new specializations necessary. If we think about what effect artificial intelligence will have, artificial intelligence is not an alternative to the doctor. It's designed to augment the possibilities of the doctor. But of course, that can only happen if that is also part of medical practice, and that we involve health professionals in the design of the artificial intelligence solutions. So this is what I was referring to. This is all disruptive because this is not the way we've been doing things for many, many years. But I think we all see the potential. So if we can manage this disruption and direct it to the areas where disruption is sometimes even needed, then I think we have a very exciting future ahead of us. But we should not be passive. Of course, this is why I made the point, we don't see innovation as an end in itself. Innovation is a tool.
The innovation then will mean that the old way of having centralized expertise in many ways will no longer be required, because it will be more distributed either within the state or within Europe.
Indeed, it's already changing. I mean, the days when a general hospital could try to cater for all needs and provide all kinds of care, I think are already gone for a long time. This is the age of specialization. We're already seeing hospitals networking. We have a good example of how powerful it can be at the European level with the European reference networks for rare diseases. We have over 300 centers of excellence in Europe, in most of the EU countries. As we speak, patients are being diagnosed and treated in collaboration. And that's a small taste of the future. I think that we will see more of that, and our job is to facilitate that transition.